The DEXA scan is an invaluable tool that I insist all my patients get to truly understand their body composition and understand hidden risk factors for metabolic disease. Dr. Jabran Sheikh, board certified dermatologist and longevity medicine expert. Today, I want to talk about my preferred tool for evaluating body composition, the DEXA scan. It is a ultra low dose radiation scan, about 1/10 the X-ray exposure as a chest X-ray, so incredibly low dose. And it gives us incredibly high resolution, detailed information about body composition. I'm going to be throwing up different components of a standard DEXA scan and the report that you'll get afterwards. And I want to tell you exactly how I, as a physician, use it to counsel my patients about body composition. We'll talk about some of the limitations in terms of understanding body composition and metabolic health and how it relates to overall health. And we'll talk about how the DEXA can help us to solve and bridge that gap. So historically, we think about body composition as a way or a surrogate marker for understanding overall health within the body. So what that means is that if a person is very obese, for example, we correlate that with lack of metabolic health, right? So they can have high cholesterol, for example. We expect them to have poor control of their sugar, insulin resistance, we call that can eventually turn into diabetes. And so consequently, we see a person who's overweight and then obese and then very obese, and we know that there's a relationship between poor metabolic health, and we call that the metabolic syndrome. And it becomes much more likely as we get into more advanced stages of obesity. But we know that that doesn't always work, that the BMI system is not a great system for a lot of patients. So on the one hand, you have certain populations, for example, people of African continental descent, who can be overweight by the BMI scale. And what does that mean? That means a BMI over 25. So normal BMI is between 20 and 25, overweight between 25 and 30, and obesity is 30 and beyond. You can just look at the standard BMI scale. It's based on your height and your weight. So in our patients of African continental ancestry, they can often have a BMI of 27, 28, but it turns out that they're actually totally metabolically healthy. Their cholesterol is fine, their blood pressure is fine, their control of glucose and insulin resistance is non-existent. They have no evidence of diabetes. On the other hand, you can have individuals who, for example, people of South Asian descent, in which they may have relatively normal BMI, let's call it a 25, for example, 26, borderline of normal weight and overweight, and they have lots of evidence of metabolic dysfunction, right? They have evidence of insulin resistance, their cholesterol is not where we want it to be. And so this is the concept of skinny fat. And what's great about the DEXA scan is it helps us to really get a higher level of granularity, much more so than standard static metrics like the BMI scale. Another example I would give is in my very muscular athletic patients. Muscle is very dense. And so you can imagine a man who's not particularly tall, who is very muscular and weighs a lot. He may be in the obese BMI scale just because he's so muscular and he's 5'6", 5'7", for example. He would be obese by the BMI scale, but then we look at him with a DEXA and we look at his body composition and we see that it's fantastic. It's so much better than a person who is a few inches taller than him and has a BMI of 24, for example, because he's an otherwise athletic person and is engaging a lot of resistance exercise and eating well and all the rest of it in order to maintain that muscle mass. So all that to illustrate why we like the body composition measurements. There are other ones, but the DEXA being the best way to get it. So a DEXA scan is readily available without a prescription. There are many places you can find a Groupon deal that can do it. They cost between $100 and $300 in most markets. In New York City, where I'm based, seeing Groupon deals for 90 or $100. And it's the kind of thing that you can get once or twice a year, and you can kind of, protocols are all incorporate protocols in my patients' lives. We will then evaluate different specific metrics that I'm going to walk you through here to see how they're doing. So the idea is that this is something that you can do over and over again. And you don't really have to worry about that radiation exposure because, like I said, it's so minimal. You could do 10 of these, a year for 5 years, and it'd be the equivalent of doing one chest X-ray. So crazy low radiation. I don't consider a safety risk at all. And so the DEXA scan takes about 10 minutes. You come there, breathe comfortably, sort of over you, and then it generates the standard report that we'll throw up here in a second. So the first thing that it's going to tell you is your body fat percentage, right? So I like body fat percentage because it tells you just exactly how much of your body composition is fat. And then the rest of that is what we call various lean indices, right? So that's your bone and your muscle. We tend to think about composition of your body, the non-water parts of your body as being bone, muscle, and fat. That's the overwhelming majority of what your composition is. So we look at the body fat percentage, and then we look at the rest, and we call those the lean indices or the non-body fat. So with respect to body fat percentage, I want to see that body fat percentage ideally under 20%. Now, for some of my older patients where frailty is going to be a concern, I will let that drift into the kind of mid 20s, 22, 24%. But once you get to 25% and beyond, you're starting to get into kind of that territory. And certainly beyond 30, you're getting into a dangerous territory. And then I have my patients who are obviously that are athletic and they want to be very lean. And so they often want to push that to 16%, 15%, and that can be healthy, assuming all the other metrics that I care about are in line. Below 15% body fat percentage, that's when you're starting to get those kind of wash abs, and I think it can be healthy up until a point, but below 10%, that's when I start to get worried about that percentage actually being too low. So it obviously depends on the individual patient, but ideally I want that to be 15 to 20%, maybe someone who's into the aesthetic. We can let that drift below 15% if everything else is healthy. Below 10%, I don't think it's sustainable for the long term. Maybe for a competition or something for a few weeks or months, it's okay. Below 10%, but between 10 and 20% is the sort of sweet spot where I really like it. Women, importantly, that's for men. Women, their body fat percentage tends to be a couple of percentage points higher. So they may have a body fat percentage of 23 or 25%, and it's totally healthy, perfectly fine. Whereas that would be kind of like borderline for a man. So it's a few percentage higher that I feel comfortable with for women. Then I'm interested in the lean indices. So that is a measure of muscle mass. And so I'm specifically interested in height, lean mass for height, and appendicular lean mass for height. And so we'll throw that up here in a second. And I'm interested in the percentile scores. So what I like to see is that compares to a normal population. That's a group of people in their 20s. So it doesn't matter if you're 40 or 50 or 60, it's going to say, well, how would you compare to a population of healthy people in their 20s? And then there's the age matched. So how do you compare to people who are in your age group? So I definitely want to see that lean muscle mass, but measures of your muscle mass. I want to see that 50 percentile plus age match, or ideally more, 80% or better. And I'm interested in how that compares to a reference population of young people as well, because in the anti-aging longevity population, it's important that you at least correlates with a young, healthy population. So that's something that we can follow over time as we incorporate resistance exercise, as we incorporate protocols. And that's particularly true in my older patients where frailty is a real issue, where if they're too frail, then they can fall and they can break a hip, and that's going to kind of lead to circling the drain pretty quickly. I've seen fall to death in a few weeks to months in a lot of cases. And so building up that lean mass and having those lean indices be really optimized is something that I care tremendously about, because it gives that kind of resilience against adversity. Within the body fat, going back to the body fat, there are specific adipose indices. So one of the ones that I care about most is what's called the visceral fat. That's specifically the fat that surrounds the organs, things like the liver, the heart, the throughout. So we know that visceral fat is much more metabolically active, right? And it is dangerous. It's associated with cardiovascular disease. And so importantly, I want those visceral fat levels to be as low as possible, right? So I've seen certainly patients who have a 22, 23% body fat percentage. You say, okay, fine, it's not so terrible, but their visceral fat is too high. And specifically, I want the fat mass to be less than 1 pound. That's about half a kilogram. So approximately 500. So I want that to be less than 1 pound is where I consider that to be the safe spot. The next thing that I would talk about specifically is the android to gynoid ratio. So android fat is the fat that's contained within the abdomen. You can imagine an apple for the shape. And the gynoid fat is that which is in the hips and buttocks. So classically gynoid associated with women, so hips and buttocks. And so the idea there is that that android fat is much more metabolically dangerous, associated with cardiovascular disease, whereas gynoid fat is not as concerning. So we're interested in that ratio, and of course that's going to vary for men and women. And then finally, I would conclude with the bone density. So bone density is very importantly as we age, risk osteopenia, which is a kind of thinning and increase porousness of the bones, and that can eventually lead to osteoporosis. Osteoporosis is very porous bones, which increase the risk of a fracture in the hip if you fall, a vertebral stress fracture, so in the vertebra of your back, lead to back pain, loss of height, those kind of things. And we have interventions. We can do calcium, we can do vitamin D, that would be the easiest. And there are, of course, medications to help prevent loss of bone density. That's particularly in women. We know that once estrogen levels decline, estrogen is very protective against bone density loss. And so when those levels decline after menopause, women are at much higher risk of osteoporosis and consequently fractures. But we know that for men as well, it's an important consideration starting in their 60s, 70s, and beyond. Testosterone, importantly, protects against density loss. And so, again, I look at the bone density, and we'll show the bone density here, or we look at the Z-score and the T-score. So importantly, Z-score is going to be how you compare to your age-matched people your age, and the T-score is going to be how you compare to a young normal reference population. And so we really want to keep those levels, and we want to watch those numbers over time, so on 6 months or 1 year, and if they're declining, we're going to want to intervene long before it's a real issue. So I hope I've illustrated to you today why we use the DEXA, why it's a dynamic tool that can be done over and over again, and it gives us a lot of information that the BMI does not. We know that the different components are important. They give us useful information. So the body fat percentage is, I think, much more valuable than the BMI, and specifically the visceral fat and where that fat is distributed, whether it's the android or the gynoid compartment. That's going to be useful. We know that that's associated with disease. We look at various lean indices, and we want to maintain those over time because we know that is a real issue as we enter into middle age and older age. And then finally, we are interested in the bone density, and we want to really aggressively protect and bottom out that risk of loss of bone density over time, particularly in our female patients. So I encourage you, get a DEXA scan. Happy to answer your DEXA questions in the comment section. And if you like this content, please subscribe,